Hello. This presentation is to help you better understand the use of opioid medications for managing chronic pain. You're watching this because you've been asked to complete some paperwork with our practice that talks about opiate medication therapy. The providers at Columbia Pain Management want to safely reduce your pain, improve your daily function, and protect you from the risks that come with opiate therapy. We stringently follow Drug Enforcement Agency and other professional society guidelines about prescribing opioid medications. And we only prescribe opiate medications if your condition warrants their use, you meet specific criteria, you've not improved with other lower risk treatments, and there's a good chance your daily activities will increase. We usually don't prescribe high doses of opiate medications because medical research continues to show that high doses have more risk than long-term benefits. The first piece of paper that we'll talk about is the Oregon Material Risk Notice. This has been developed by the state for all practices in Oregon that prescribe opioid medications for managing chronic pain. Please take a look at the paper now. You'll see that there's a place for your name and for the medications that we will use to control your pain. You'll see that there's a place for the diagnosis that best describes your pain condition. And then there's a place for you to list 3 goals that will help us determine if the medication helps your pain and activity level. Think of concrete goals, like being able to walk around the house, being able to sleep better, or perhaps continue to work. There's a place for us to put alternatives to opioid medications that might include other types of medicines, injections, physical therapy, and counseling to help you achieve your goals. There are risks with using opioid medications. First, opioid medications can affect driving or using machines. They can cause sleepiness, and they may decrease reaction time. These side effects can last for 10 to 14 days after starting opioid medications or after making changes to the amount prescribed. People do become used to the side effects, but you must be aware that they may occur when the therapy is started or any time a dose change is made. In general, you should avoid driving a motor vehicle or operating equipment if you feel impaired while taking any medication, including medications in the opioid class. Second, you should understand how opioids and addiction relate to each other. Addiction is a brain reward center syndrome. People who are addicted can't control the use of their opiates. They crave the medicine, and they use the medicine even though their life is at risk or actually harmed by the medicine. Addiction is a serious potential side effect of long-term opiate use that many providers are just now understanding. Addiction is not the same as physical tolerance. Physical tolerance is something that happens to everyone if they take opiate medications for an extended period of time. Their body gets used to the medication, and they'll experience discomfort if it's suddenly taken away. All of our providers look for signs and symptoms of addiction and offer appropriate referrals if this becomes an issue. At the end of this presentation, if you feel that you would like a formal chemical dependency or addiction evaluation, please ask one of our providers to assist you with the resources and next steps for obtaining this service. Once this presentation is finished, there's information for you to complete at the bottom of the Oregon Material Risk Notice. You will either check that you understand the information in the notice or that you asked for more information and understand the additional information given you. The second piece of paper I'd like to review is the Opiate Treatment Agreement. This document explains your responsibilities and our responsibilities so that we may continue to prescribe these medications. You will see it first says that you agree to be personally responsible for your medication, and you understand you may not be prescribed replacements for medications lost, stolen, misplaced, or otherwise outside your personal possession. Take notice of this. The use of these medications is a serious responsibility, and we need you to keep track of your pills. It's important to realize that regular follow-up will be necessary for us to monitor your progress, to ensure that the medication continues to be helpful and improve your function, and that you're not experiencing severe side effects. At first, you may have frequent follow-up visits. As you stabilize on the medication, the visits may stretch out, but you must keep your appointment for follow-up visits. Our clinic will not refill opioid medications over the phone. We ask that you get all your opioid medications from one pharmacy and that you receive opioid medications only from Columbia Pain Management. We request that you bring in your medications in their original pharmacy containers so that we can count the pills and ensure that you're getting the correct amount. This is important to remember. We may not be able to refill your medication if you do not bring in your pill bottles to visits. Our practice performs pill counts at every medication follow-up visit. That means if you come in and need an early refill, we will be counting to make sure you have the appropriate number of pills for that time. We consider pill counts an important part of your overall pain treatment, and again, ask that you bring your opiate medications in their original pharmacy bottles to every follow-up visit for counting. Finally, the agreement says that we have a program of urine drug screening. All new patients provide a urine sample for screening. If you decide to begin opiate therapy, you will be included in the clinic's random urine drug screening program. All of our patients' prescribed opiate medications are included in the screening program. Screening results show whether patients are taking the correct medication, that they're not taking any opiates not prescribed, and that they're not using any illegal substances. We do not prescribe opiates to patients who are using illegal substances, including marijuana, whether prescribed or not. If your urine drug screen results show illegal substances, including marijuana, your care will be transferred to another provider and your medications tapered and discontinued. We will help you find a qualified chemical dependency or addiction treatment center. That concludes this presentation of the risks, benefits, policies, and procedures of opiate therapy for chronic pain. We are honored that you've selected us as your pain management provider and look forward to working with you to safely manage your pain and improve your function. In a few moments, your provider will be available to answer any questions you may have. Thank you.